There is no case in front of me.
You have two more slides.
Okay, you can please.
Can I move forward?
Okay.
Okay, your 2 minutes have completed. I am starting your 10 minutes. Please start.
Okay. Hello, I'm Navuna. Is the doctor in the clinic today. May I confirm your full good name and age, please?
Yes, doctor, I am Karen Smith, 35 years old.
Hi, Karen. Karen, I'm sorry, but my consultant is on the way. May I continue the consultation with you today? Then I'm going to give you another appointment with him.
Okay, doctor.
Okay, thank you, Karen. May you tell me, please, how can I help you today?
Yes, doctor, I am 30 weeks pregnant and I have twin pregnancy. And I am just here to discuss my delivery plan because I'm planning for home delivery.
Yes, I completely understand. Okay, Karen, may I ask you some few questions to know more about you? Then I'm going to discuss and reach with you for an agreed mutual safe plan.
Okay, doctor.
Okay, may you tell me more about your pregnancy?
Doctor, I'm fine till now. I have undergone different tests or ultrasounds and everything is okay.
Okay, congratulations for your pregnancy. And
Thank you.
what about the growth? As I see the growth, I think it is not. They are not both babies. They are not the same growth as I think. Did anyone inform you about that?
No, doctor told me that both of them are normal growing.
Okay. Do you have any pain or bleeding or discharge?
No, doctor.
Do you know? Did you name your babies?
Yes, doctor. These are Lisa and Jane.
And who? What?
Lisa and Jane.
Jane. So both are girls. Okay. And do you have any problem so far?
No, doctor. I'm absolutely fine.
Okay. Do you have any medical condition?
Sorry.
Do you have any medical problem or any
No,
medication?
doctor. I'm feeling fine. No, doctor.
Do you have any allergy?
No, doctor.
And what's your height weight ratio?
It is normal. 22.
Okay. Do you have 22? Do you have any surgeries before?
No, doctor.
Do you have enough support at home?
Yes, doctor. My partner is very sportive.
Okay. Okay, Lisa, coming to your concern first, maybe may I examine you and search for you, look for your notes? May I? Because I wanted to check for the baby's growth and
Yes,
the weight
doctor.
and Okay, thank you.
Yes, doctor, no
Okay,
problem.
coming to your concern, Lisa, may I know why you want to have home birth?
Yes, doctor, my one of my friend had a hospital delivery. She also had a twin pregnancy, and one of her baby got stuck, and she was in labor for a long period of time. At last, she had to undergo cesarean section. It was
Yes.
very frightened experience. I don't want that similar things happen with me. That's why I don't want home. I don't want hospital delivery.
I completely understand your concern. Lisa, every woman, she has the right to have, to know when and how to have their babies. And the home delivery is good option about being familiarized with the surrounding and feeling more relaxing and surrounded by people that you know. Uh, but I think it is not a good option for you. May I tell you more about this?
What are you saying? It is not good option for me.
Maybe it
Why,
doesn't suit
doctor?
you. Maybe it doesn't suit you. I didn't mean that it's not good option, but I'm sorry. I mean maybe it doesn't suit you because first you have a twin pregnancy, as you said that maybe one of the babies will stuck, and maybe we'll have we need for an urgent interference for the baby. At this time, we need to be in a consultant lead unit because they are the twin pregnancy. We want to have continuous monitoring for the babies, and you want to have someone to take care of you during the delivery as well. Am I clear so far?
Yes, doctor.
And it will be according to the first baby. It is by the head or by the buttock first. Because if the baby with the buttock first, I think maybe there will be some problem during delivery for the baby. And even if
Yes,
the
doctor.
head first.
I have undergone ultrasound. I have undergone ultrasound last week, and my baby is head first.
That's good. That's good to hear from you about that. But as I see that even the two babies, they don't have the same weight. Yes, they are growing well, both of them. But one of them it is smaller than the other side. The other one about more than 20%. So they need a special doctor to be present, the baby doctor, and to prepare a cot for them, both of them, and they will prepare as well as the theater. Maybe in case that there will be an emergency that we want to deliver the baby by cesarean section, or maybe we need intervention. I really I don't mean to scare you, but because your safety and your baby's safety is our paramount. Am I clear so far?
Yes, doctor. But my was saying that if in case any problem arises, I can be shifted to the hospital.
Yes, yes, of course, it can happen that if any problem can rise, we can shift it to the hospital. Is your house is away far from the hospital?
It is not very fast. Just it is 20 to 30 minutes away from hospital.
I think 30 minutes during pregnancy, it will be far. What do you think so? If in case of any emergency will happen, I think 30 minutes it will be a very considerable time that maybe it will be sometimes it will be life-threatening condition for one of the babies and even for you because during delivery maybe one of the baby can be stuck or maybe cannot be delivered or sometimes after the first baby will be delivered second baby change her position and because of this maybe we will need second cesarean section even for the second baby around 400 women and sometimes after the delivery of the babies one of them or both of them I'm sorry to tell you that maybe will need special care for their breathing so the baby doctor will be present to take care of you and sometimes the mother maybe she will have some bleeding after the pregnancy, especially that they are twin pregnancy. Mothers they are more prone to have some tear or bleeding after delivery. So after delivery, we want to give you some treatment to prevent any bleeding after the delivery. And as well, if you are going to deliver in the hospital, we can give you a appropriate painkiller So in case we need any maneuver or procedure to be done for any one of the twins, so it will be more appropriate for you. What do you think, Karen?
Yes, doctor, because I had made up my mind to have a home birth. I'm not able to make a decision right now.
Okay, may I give you another appointment with my consultant and some written information about that? And we'll make for you another scan to be sure about the babies, both babies' growth and the water around the babies. Then we can have another discussion about this. Is that okay for you?
Okay, doctor.
Okay. Do you have any other concern, Karen?
No, doctor.
Okay, thank you.
Thank you. Okay, Noani. So, how you feel about your station?
I don't feel good. It
No,
is the
no, you
first
have
time for
tried
me.
very
Yeah.
well.
Okay, thank you.
Okay, you performed for the first time, no problem. But most of the points are okay, and your idea was good. Just few things need to be improved. Okay. So
Okay,
it was
thank
a
you.
type of negotiation station, and out of 14 station in the exam, at least there will be one negotiation station, and most of the time it is about your communication skills, and uh, it is it is very easy to learn how to negotiate with the patient. Okay, the patient should never think that you are trying to impose your decision on her. Okay, so in this case, you said that home birth is not a suitable option for you. So it is not a good point to say straightforward to the patient that it is not a good for you. You have to tell all the complications which can arise in home birth and let the patient decide for herself, because patient is making the decision of home birth without knowing what complications can arise home birth, and when she will realize that she can have so many problems in home birth, then she will make decision for herself. On the other hand, when you will say her that it is not suitable option for you, you should have home hospital delivery because in the hospital such facilities are available. In this way, you are convincing her. Patient will feel that you are trying to convince her to some other option. Am I clear?
Yes, you are clear.
Okay. So now I will tell you what steps you will follow so that the patient will understand your advice, right? Okay. So information gathering was okay. Most of the points you covered. Some relevant history you missed, like you did not ask about was it a planned pregnancy or a spontaneous pregnancy, and type of twins you missed. You can ask, are you aware what are the types of twins? Because in this case, this was monochorionic and diamniotic twins. So
Yes, I
and
asked her about
uh,
the names and she said both are girls.
yes, rightly you asked about the names, and it is very good point because this station was always also carrying the lay examiner, and such points give very good marks. And if you always ask the name of the babies and in such type of stations, right?
Yes, I mean
Yes.
by that, not only making her, but only I wanted to know what is the type of the babies. And she
Okay,
said,
you want it. Okay, right, right. Because in the dichorionic pregnancy, twin pregnancies, the baby sex can be same. Okay, so just by knowing the sex of the babies, we can't be sure either it is monochorionic or dichorionic pregnancy.
okay.
Okay, if you will simply ask, are you aware what are the type of twins? Then most of the patients with twin pregnancy know that they are sharing their afterbirth, whereas their sex are different. So the patient will tell you, and they can also tell you that whether the first baby is presenting, head is presenting first, or the buttocks are presenting first. Okay. So you took the relevant history about the pregnancy, any problems in the pregnancy till now, how is the growth of the baby, and medical history, surgical, allergies, BMI. So relevant history you took, and so information gathering was good. And when you will come to the station, so first of all, what you will do, you will make the patient comfortable and accept her right of autonomy. So this thing you did well. You appreciated her decision of home birth, and then you discussed different risks. Okay. So I'm telling how you will do it. So Karen, first of all, I like to tell you and reassure you that whatever you will decide, we will respect your wishes because every woman has a right when, where, and how to deliver. Then you will appreciate her decision of home birth. Okay. How you will appreciate? Definitely, home birth is a very beautiful experience, and being away from the hospital and being in a familiar environment and around familiar people, it is a perfect way to deliver, Karen. I really appreciate that. So when you have followed these two steps, patient will think that you are on her side. You will make patient as her party, and patient will think that you are not opposing her, you are not convincing her. And these two steps you can use in every type of negotiation station. Okay. Now the next step is that you will take her permission to discuss certain concerns. So how you will speak? Karen, if you allow me, can I discuss few concerns which I have regarding your pregnancy? Karen, I have two things in my mind. First of all, it is your first pregnancy, and secondly, you are carrying two babies. So this pregnancy is different from the pregnancy from the second or third pregnancy, or uh, when there is a single baby. So do you want me to discuss in more detail? Okay. Then first of all, you have taken the permission to discuss the risks in her pregnancy, and then you will discuss all the risks step by step, and then you will ask her thoughts, know what she is thinking. Okay. So how you will speak? I'm just telling. So, as it is your first pregnancy, we don't know how you would respond in the labor because you don't have a prior experience of labor, Karen. Okay, and Karen, carrying two babies puts you at higher risk than carrying a single baby because we need to monitor the two babies very vigilantly during the labor. And at times, there are risks that after the delivery of first baby, the second baby may stuck up, and in that case, we need emergency cesarean section. So, in case it happens, it might not be possible to reach the hospital on time. And sometimes, as it is a twin pregnancy, after the delivery of babies, the womb may not contract, and there can be excessive bleeding. And to manage such situation, we need a team of doctors and specialist doctor which are available only in the hospital. So Karen, in case of emergency, I just like to know what are your thoughts? What would you do? Taking a decision for yourself is your right, but in case these complications arise, I would just like you to reconsider your decision just for the sake of these things. Okay? Okay, Nwani? I have told all the risks and then I am
Yes.
asking the patient to reconsider what is she thinking. Okay.
Okay.
In this all the scenario, you have seen that I have not asked her to go to the hospital. I am just telling her the risks, what she is carrying, and then I am asking her what she is thinking. Okay. In this way, I am giving her full right to take a decision for herself. Okay. Then I said that she said that her friend has a horrible experience. So you should also address this concern also. Okay. So how you will address this concern? So as far as Karen, your friend is concerned, I respect. your concern, and I also respect the level of anxiety and stress in you. However, every individual has different circumstances, and the situation your friend passed through is not necessarily you are passing through the similar situation. However, it is totally your wish. Whatever you plan for yourself, me and my team are going to support you in that. Am I clear so far?
Yeah, yes, I can. Yeah, yes, thank you.
Okay. So, in this scenario, yes, okay. So she was making the decision of home birth because she is not aware of the complications. So our aim is to uh, tell her what complications can arise so that she can make decision for herself. Taking the decision of home birth is not a problem, but taking the decision of home birth without anticipating the complications, this is the problem. So this is the key in the negotiation skill. The examiner should never think that you are imposing your decision on the patient, right? And then the patient when said that I am about just 30 minutes away, I can reach on time. So how you will handle this situation? You will say, Karen, certain circumstances are beyond our control, like traffic lights and crowded roads. So have you thought what would happen in that situation? Right. So address all the concerns. Always ask why she's wanting home birth, and then tell all the risks and let the patient make a decision for herself. Right. And then give her follow-up appointments because this is monochorionic pregnancy. She needs fortnightly visits, and you rightly addressed her at the start because the consultant was not there, and it was a good point. And then you offered her another appointment with the consultant, right? So most of the points you covered. Just I have a concern that you asked her that uh, this you should have birth in the hospital. So this thing needs to be improved. Okay.
I'm very thankful for you, doctor. Thank you.
Okay. So from the communication point of view, the points are same. Greeting, introduction. At the start, you mixed up the things. Just keep the aim of consultation and agenda separate. And then you took permission to ask questions, set an agenda, and give information in chunks. And there should be a clear plan. So these communication points you can apply at each station and ask understanding in between. In information gathering, you elicited the reason of home birth, you took relevant history, and you explored her worries and explored her ideas, concerns, and expectations. You explained about the risks of home delivery, and it should be evidence based, and explain recommendations about when delivery. And this is the patient safety. This growth chart was normal because although the growth of different two babies are different, but both of them are above the normal range. So you will reassure her that her growth chart is normal, and you asked about her sport rightly. You offered her another appointment, respected her wishes, always involve patient in the process, and offer consultant at care. Right. So these are the same points. Anyone has any question? Am I clear so far?
And we should ask about folic acid 5 milligram whether she has taken, and even aspirin. That should have been asked, no, ma'am? Or I can
It
go through
becomes
the.
very detailed. It becomes
Okay.
because now she is 30 weeks.
Time may not be.
There is no relevance.
Okay.
Yes, yes, yes. So she asked in general, is her pregnancy okay? Any problem till now? Because primary gravida and twin pregnancy, we should also offer her aspirin. So because this is a basically a negotiation station, and at the start you can see that she has to discuss about she wants home birth, and the plan of she's here to discuss plan of management. If we go in so much detail, then we will not be able to complete the task.
Finish.
Okay, right. Okay, so the next session will be done by Dr. Seema. Seema, are you here?
Yes, I'm here.
Okay, so
Allow me to share
okay,
my
please
screen,
share
so
your
I will
screen.
start. Yeah.
Yes, 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 I've allowed you.
Okay. Thank you. So everyone can see my slides. Hello.
Yes, ma'am.
Yeah. Okay. Manikam, regarding your question of aspirin, so if the during the history, if you ask about
No.
whether are you medically fit and fine, patients say
Hmm.
yes. So at the same time, you can inquire about are you taking any sort of medication. If the
Okay.
patient utter that I am
Hmm.
taking aspirin, so
Hmm.
for the aspirin, if there are more than two moderate risk factors, so we can patient can have aspirin. So if the patient at
Okay.
35 is, if the patient is taking aspirin, so you can, because it's a safety point, so you can say that you have to stop aspirin at least once you started labor pain by your own. Otherwise, you can start before your 36 or
Okay.
37 weeks, whatever the written in the guideline. Okay, so you
Okay.
can say. So how can you know the patient is taking any special kind of medication or not? So you can inquire in the history that whether you're taking any sort of medication. Folic
Hmm.
acid
Hmm.
is not relevant in this because she's already 35 weeks. Okay,
Okay.
so
Hmm.
now moving ahead to second station, well, labor and delivery is very important module, and most of the variety stations can come from the labor and delivery. It can come as a structured discussion. It can come as a teaching station. It can come as a counseling and negotiation station. Okay, so variety of station can come from this module. Okay, so um, who is going to perform this station? Any volunteer? Please, girls, come forward.
Ma'am,
This is
I
the
can do.
opportunity for
No,
you.
no one is willing, then I can.
Okay, you
I
Shaista.
can do,
So,
ma'am.
okay, who are you? Please tell
Ma'am,
me your name.
Gul, Dr. Gul.
Okay, Dr. Gul. So I'm making you are appearing in the exam, no?
Yes, ma'am.
Okay, good. So I'm setting your 2 minutes time. Okay, you see my slide properly, no?
Yes, ma'am.
Okay, so your time starts now. You have 2 minutes.
Okay, ma'am. Any other slide, ma'am?
No, this is the only slide. Okay, you are ready?
Okay, ma'am.
Good. Okay, now start.
Yes. Hello, I am Gul, one of the doctors working in the labor ward today on duty. May I confirm your name and age, please?
I'm Helen John. I'm 24.
How may I call you?
Helen, okay.
Okay, Helen, how are you doing?
Yeah, I'm having labor pain. That's why I admitted in the midwife ward, and I'm here taking my pain relief. All's going good.
Yeah, so you have taken pain relief. At the moment, you are fine to continue the consultation with me.
Yeah, it's okay.
Okay. So Helen, midwife has called me and she has some concerns. So are you aware of the situation?
Yeah, midwife told me that my baby is bottom first, and it has been confirmed by scan.
Mm-hmm.
That's why midwife told me that some senior doctor will come and talk to you.
Yeah, yes, I am here, Helen, to talk to you and rectify your concerns. So would you mind if I ask you a few quick questions to know more about you, and then I can discuss the further management plan with you?
Yeah, okay.
Okay, so Helen, is it your first pregnancy?
Yes.
And how's been pregnancy so far?
Yeah, it was a normal pregnancy. Everything was in normal range. And throughout my period, midwife told me that everything is okay. But I'm just a little bit surprised that everything is okay. And I had a plan to have a normal delivery with my midwife. So how can it come to be a bottom first baby? Why it has not been detected uh, previously? Or why they haven't done a scan in my last month of my pregnancy?
I can see that you are angry and you are worried. I will look into the matter. I apologize for what has been happened and it was not detected. So I will look into the matter and I will also review your notes and ultrasound report and all your pregnancy notes to have a more detailed look into that. And also I will look at into the matter and involve the raise an incident report and involve my consultant. Okay, you have pain, Helen. Very good. Very good, Helen. Very good. Excellent.
Yeah, okay.
Is it fading away now?
Yeah, it's okay. Okay, you carry on.
Okay. Okay. So are you okay now?
Yeah, yeah, fine.
All right. So I will look into the matter about that why it was not detected. So you had your ultrasound scan at 20 weeks.
Yeah, first was at 13 weeks and the last one was at 20 weeks. Yeah.
Okay. Any other problem throughout the pregnancy like diabetes or high blood pressure?
No, doctor, midwife keep me saying that I am a low risk pregnancy and I deliver normally. And I also want to have a normal delivery. I don't want to have a C-section. I was heard by the midwife who was discussing that I might have a C-section. I don't want to have a C-section.
Okay. I can see that you are keen to have a vaginal delivery. Yes, I will discuss all the options with you and you can take decisions and I will respect your decision. Okay, Helen?
Hmm. Yeah.
So you went into labor yourself?
Yeah, it started by itself. Yeah.
Mhm. Can you feel the baby kicking inside?
Yes.
Okay. Have you named the baby?
Yeah, it's Lisa.
All right. So Lisa, you can feel Lisa movements.
Yeah.
Okay, that's good to know. And any water you was broken, you can feel?
No, my water bag intact here.
I see. Any allergies you have?
No,
Any regular medicines you are taking?
no,
Any medical problem, Helen?
no,
Any operation in the past?
no.
Okay. And so do you know your weight to height ratio?
Yeah, normal.
Your blood group?
A positive.
Any reservations for blood transfusion if need arises?
No.
Okay. And is anyone around you, Helen, with you,
Yeah, my
companion?
partner. Yeah, my partner was with me, but he stepped out for a cup of coffee.
I see. So you have good support at home?
Yeah.
I see. Okay. Okay. So thank you for sharing your information, Helen. I will quickly have examination in the presence of chaperone with your permission. And
Mhm.
so midwife has got the examination done. So I will check the baby heart, and midwife has examined and told me that you are at 4 centimeter. The neck of the womb is open 4 centimeter till now.
Mhm.
So I will
Yeah.
discuss certain options for you that how you can deliver.
Mhm.
Okay, so Helen, at the moment you are in your first pregnancy, and so how far is your pregnancy?
Yeah, it's around it's 40 weeks.
All right, okay. So at the moment you can have three options, Helen. So the first option is that we can rotate the baby from the bottom first to the head first position, and also the second option is going for that vaginal delivery with this bottom first position, and the third option is going for a cesarean section. So I'll discuss one by one. So you can have any questions you can ask me. Okay, Helen?
Okay. Yeah.
So, yeah, so first option is the rotation of the baby from bottom first to head first position. We call it external cephalic version. It can be done now, and we will check the heart rate of the baby before and after the procedure, and that would make the baby head first position. It is successful in half of the patient as your waters have not broken, and is there safe option for you? For that I will also look into the notes for the weight of the baby, the position and neck position of the baby, so if it's safe for you, so it can be done now, and after that high chance of having a vaginal delivery in the head first position. So there is small chance that sometimes emergency cesarean section may be needed, but that is a 1 in 200 chance. Am I clear so far,
Mhm.
Helen?
Okay.
Any questions?
No.
Okay, so the second option is that going for a vaginal delivery with the bottom first position if the that rotation of the baby is not successful, or that is not you have not opting that position. So vaginal delivery, that I'm sorry to tell you that may be a little risky for the baby. Although it's a safe option for you, but that can be risky for the baby. So in you the normal vaginal delivery is, you can have a safe easy delivery next time, and you can have a skin to skin contact with the baby, early breastfeeding, early discharge and early recovery. But however the baby, it can bit risky because they may need some help to deliver the baby. Some senior consultant would be involved, and some special help and maneuvers to deliver the baby. Sometimes there can be small injury to the baby during the delivery of in the bottom first position. Am I clear?
Actually my friend had a bottom first baby, and she delivered nicely. Both my friend and her baby were normal. There was no issue. And you're
I
trying
see.
to scare me about having a vaginal delivery with bottom first baby.
I can see that you are scared, but I don't want to scare you, Helen. I will just giving you the options, because if you go for a opt for a vaginal delivery in the bottom first position, that would be in the hospital under the consultant net care, and the senior would
Mhm.
be involved, the senior obstetrician, and also the baby doctor would be involved. Your midwife would be involved. So if any help is needed, that can be provided. But still, by evidence, the safest option for the baby uh, is going for a cesarean section if the turning of the baby is not successful. But you can make your
Mhm.
decisions. I'll give you some information leaflets regarding all the three
Mhm.
options, so you can quickly go through them, and we can
Mhm.
take decision together.
Mhm.
Am I clear so far,
Okay.
Helen?
Yeah, so if I go ahead with the cesarean section, so what will be the affect my future pregnancy? Will I have a normal delivery or not?
Yeah, so if you go for a cesarean section, so that would be the future deliveries may be regarding requiring the cesarean section, and difficult, that can be difficult for the due to the scar tissue and the afterbirth problem that can be inherent, and requiring blood transfusion, difficult surgery. But with regards to the baby, that is the safe option, that baby can be delivered and safe for the baby. But in you, these there are certain risk, anesthesia risk, or risk of bleeding and requiring blood transfusion. So these are the risks. Okay,
Okay, close your station.
thank you. I will have a appointment of you. I will also discuss your case with my consultant, give you information needed so you can have your decision, and then we'll go forward with that. Thank you.
Okay, thank you. Thank you. So, girl, how do you reflect on your performance?
Yes, I think I can be a little quicker. So I should close before 12.
No, in fact, you perform very well, and you try to um, you try to cover all the most important points. You give all the options. You never throughout the station, you never impose your decision on the patient. You address the concerns. You keep involved the patient in the loop of your conversation. And meantime, you reassure the patient that everything, whatever the thing would be done, it will be with the patient consent and the patient wishes being respected. And you also address this thing that why it is not detected. So at the same time, you never blame your colleague, and you just the thing you handle that situation is very important. In a very good way, you say that we cannot comment what actually has happened, and we seriously we look into the matter and we will discuss with you. So all these things are very good, and you. But one thing is missing, that once the patient in between told you that once you start taking the information gathering, okay, your information gathering took a little bit later time. Okay, it has to be very fast as possible,
Mhm.
and meanwhile you just ignore of addressing this thing, that why the patient don't want to go for a cesarean section. Okay, if the patient say you, so at the same time you can inquire, may I know, Helen, why you are not? Is there any particular reason for not having a C-section? You can inquire.
So
Okay,
in that
and
case,
then you
I
rightly.
think the student, yeah.
Hello, and then you give all the three options very nicely. Okay, but first option would be given as a breech vaginal delivery, because we have to start with the option which patient wants. Okay, and then you can, there's another option in which we turning the baby through a dummy and this and that. Okay, so otherwise your station was very good. Let's see on domain wise. Okay, information gathering, you take the relevant history, inquire about the how the pregnancy was so far, and you inquire about any current complaint, movement, and the name of the baby. You review the notes, and you inquire about the underlying worries, what are the patient views and expectations regarding this condition. And this is the first pregnancy, so there's no obstetrical history. Inquire about the allergy, and these things are important because this patient, because the suggested option for the women who are having a quarter first baby is a recommendation cesarean section. So it's very important we should know whether the patient has having previous surgical history or blood group or reservation. Otherwise, medical history, or you can say that I need to review all your case notes to find out whether there's any significant uh, history or not. You can omit lots of the thing. Okay,
Mhm.
and it's very good that in such kind of laboring station, you can omit personal history and
Mhm.
social history.
Smoking
All these things can be omitted.
and
And important thing is that once you start your station, so you start that I am Dr. Gul, who is covering the labor ward. Then you start, may I know your name and age, please? This patient is already admitted in the labor ward. Midwife has examined this patient and give you all the relevant information to you, because this patient is having uh, breech presentation, and you have to discuss the option of delivery, because the cesarean section, because basically you want to discuss the cesarean section. Okay, and
Mhm.
let's the patient concerns also needs to be addressed. So this patient is already admitted, this is not a OPD consultation. So you can see
Mhm.
that hello, I am Dr. Gul, one of the doctor who covering the labor ward. Am I talking to Helen John?
Mhm.
Then Helen John say yes. Okay, so is it okay if I call you Helen, or you can say that how may I call you? So the Helen say that you can
Ma'am,
call me
names are
Helen.
so much
So
difficult.
hello.
Sometimes the names, ma'am, sometimes the names are so much difficult to pronounce. So that's why
Hmm.
we want patient to role player to pronounce their names first. That's
Hmm. Okay, but you
That's
know
the
this patient. Yeah, I can see, but this name is
inclusion.
easy to read now. If the name is easy to read, so you can practice. You have to practice like this. May I talking to Helen John? Okay. So
Okay.
that's so because this patient is already admitted. So there's no need. May I confirm your name initially? Because this first time consultation with the OPD in the clinic scenario, you can have this kind of introduction. Okay, these are the little things which mark impression. Otherwise, your blind and knowledge was up to the mark. History is okay, and your communication was wonderful. You introduction, you checking of attending, you making the rapport, and meanwhile how you address the patient concerns. You set agenda. Meanwhile, you inquire about the most important thing. I'm glad that you asked why was called. So you inquired the patient background knowledge, whether the patient aware about the consultation with you, and the patient open up that yeah, I know. Midwife told me already that I'm having a bottom first, but I'm not happy. Every time they told me that I'm a low risk, I'm a head first baby. So this thing is very important that you explore what the whether the patient has know about the background information or not. Then you explain all the explanation in a very logical sequence, and you very nicely you have explained all the risk and benefit of each option. And the good thing is that you keep silence during the contraction. Okay, and you also utter these encouraging words. This is a very good thing, because most of the time we just in order to complete our station within 10 minutes, we keep on talking and just ignore the patient. So this is the main thing. Okay, so this thing is very important. You respect the wishes, and you provide the information leaflets within like before ending of your station time. You have uttered these words that I'm giving the information leaflet. Okay, so this point has been given to you, and you try to avoid all the medical jargon and to make a very clear management plan. So this domain is also passed. As far as the patient safety is concerned, so you provide all the accurate information. With breech, there's a risk of you explain that there's a risk of a baby heart rate may get abnormal, and that there's a higher chance of the cesarean section, and there's a risk of the. You can also say that the cord may come early. With the ECV, there's option that water bag may rupture, cord may come out, early separation of the afterbirth, and there's an increased risk of cesarean section, which is about there's a failure of the procedure. But you can offer, you can say that ECV turning of the baby through the tummy to a head first position is another option by which you can have a normal vaginal delivery. It can be offered now, but the success rate is 1 in 2. But as you are already in a labor, so chances of successful of having this procedure may be a little smaller.
Yes.
You can say these words. You cannot 100% reassuring that okay, this procedure will be up to the mark. No. So you can say this thing, and this procedure itself increases the risk of having an emergency C-section. So you told this thing, but you have to say that we can offer, but as you already in the labor, so chances of successful of having this procedure is little bit smaller. The suggested and recommendation is the C-section, and you can rightly say that C-section is the safest option for your baby, but it has got some implication for you, like that the role player will inquire about what would be the option, because your time is getting less than 30 seconds was left. So I just uh, raise this question: what will be the option if I having this, if I opted this C-section? So you can say that this is the safest option for the baby, but for you there may be a risk for you that your recovery may take longer. There's a slight increased risk of infection, and there may be a risk for your future pregnancy. Maybe a problem with attachment of the afterbirth, and maybe a difficulty in doing further surgery. So these will be the options. These will be the risk. And so the main thing is that, and with the beach deal, you rightly said that this is the safest option for you, that you will have quicker recovery, and you will get back to work, and you will have a normal delivery next time. But it has got some problem with the baby, and there may be some short term complication in terms of injuries and fracture of the bones of the baby. So these all are the risks associated with the beach delivery. Okay. And for breech delivery, you have to be in our space. Like you told all these things, that a special team of experts will be taken care of, and the baby heart rate would be continuously monitored. If any emergency thing arises, because those women who are having a breech vaginal delivery, out of 10, 4 may end up in a cesarean section if any problem arising related to the fetal heart rate, or if there's any stop of the labor or the progress of the labor will not up to the mark. So these how you can say the pros and cons. So I'm giving you all the information, and whatever you decided, we will go ahead with that, and your respect will be respected. And as Helen, you are in the early phase of the labor, so I'm giving you the information leaflet. You can discuss, and very rightly you inquire about whether there's anyone along with you. So you can discuss with your partner. I am right here. Like once you are closing the station, so it's not I'm making another appointment. I'm right here to look after you, and once you have decided, just call me. I will come back to you with my consultant. Okay, that's how you can close your station. Okay, in the last line I have mentioned these, that if your station reaches that level that she say that yeah, I'm go ahead with the cesarean section, so then the consent and antibiotic and documentation, all these things is very important. And if she is still willing for undergo for a breech vaginal delivery, so I have to document all the things, and I'll make I'll call my consultant. I request my consultant to have a to assess you, and to have a review
Word
you.
with you.
Yeah, to have a word with you. Yeah. Okay. Now, patient, now the applied clinical knowledge. Applied clinical knowledge is very important. That ask her concerns, and what are her concerns, what the patient wants. It's very important. Discuss it first. Okay. So, breech vaginal delivery pros and cons. And it's very important that you rightly say that we need to rule out for the patient vaginal delivery. It's very important that we need to rule out whether it is a suitable option for you or not. We need to have a detail. We need to assess you by my consultant and have a detailed scan to see what's the weight and what's the position of the neck of the baby. Okay. So and it is good that you have a less hospital stay, safest for you. We can avoid the surgery, but there is that even 4 out of 10 can have a chance of cesarean section in case if the progressive labor was delayed, or if any concerns regarding the fetal heart rate. And you rightly inquire about the concerns, and you rightly say that have an inquiry and do the incident reporting of the undiagnosed breech. Then ECV, again, you explain all the things. You explain this ratio also. 1 in 200 chance of C-section in case of failure, or in case of abnormal baby heart rate, or if there's a detachment of the afterbirth. Okay, blood group is O positive, so there's no need for NDD. Then breech cesarean section, again, that it has got some implication for the future surgery, but it is safe for the baby. So this station is all about how you tackle the situation. The main thing is that keep silence in between the contraction, and address the patient concerns, respect the patient wishes, and if the patient says something, so it's very important, then don't undermine your colleagues. Okay, just say that we cannot exactly comment. Usually, a midwife, if there's a low risk pregnancy, so they all deal by the midwife. They are experienced in dealing such kind of cases, and usually we are not doing any scan in the last month. If the midwife is suspect something, so it can be done, but again we cannot exactly comment what was happened. So we definitely do the inquiry, and what will be the result, we will open and honest to you. So that's how you can um, close that issue. Okay,
Okay, ma'am. Okay, thank
Dr.
you.
Gul. Yeah.
Yes, ma'am.
So you perform very well, and it's basically it's a pass station for you.
Okay, thank you, ma'am. Thank you so much.
Okay. Any question? Anyone has any question regarding the station? Actually, these labor and delivery module, you can have a counseling station, you can have a
Dr.
negotiation
Seema, she is
station.
already 4 centimeter dilated. So should we discuss external cephalic version because she is in
Yes,
established labor?
yes, he is an established labor, but the water bag is intact. Once the water bag is intact, you can try for
But the
external
failure rate
cephalic
will be
version.
more.
But yeah, exactly. This thing has to be mentioned that
Okay.
as you are in labor, so the chances of
Hmm.
successful of having this procedure is little
Will be less.
smaller.
Okay.
Hmm.
Okay. Fine.
Okay. If the water bag has already ruptured, so we cannot offer this procedure. Okay.
Thanks.
So, how do you people find our these sessions?
Very fruitful, ma'am.
Yeah, thank you so much. So our aim is to keep you on the right track, and if there are any shortcomings, so it will be corrected at this point of time, rather than you make these little mistakes in front of the examiner. So hopefully that this session is also fruitful for you. So the recording of this session will be uploaded shortly in our YouTube channel. So thank you for now.
Thank you, ma'am.
And if you have any questions, so you can post in our Telegram group. Okay. And
Ma'am,
from next
labor or
week, we are
prioritization.
okay.
Next.
I think we can have a separate session on the labor work prioritization before your exam.
Thank you,
I
ma'am.
noted down. Okay.
Mm.
I will have
Mm.
this session. Okay. And from the next week, I will be started these group activities regarding the book. Okay. So you can post your recording.
Mm.
Okay. So thank you
Thank you
for
so much, ma'am.
Thank you.
inviting. Okay. Thank you. Bye.
Thank you so much, ma'am.